Welcome, everybody.
Hey.
Hi, Jonathan.
We decided to come together a little bit since we did all this work together and kind of discuss why we did it, how we did it, what kind of topics we decided to focus on, and try to let everybody know who's going to be using this resource. Let them know a little bit about us and how we are, who we are, why we did what we did. Sound good?
Yeah.
All right, so I'll introduce myself first. I'm Jonathan. I have been serving the senior care industry as a vendor partner for the last 13 years, and I'm pretty passionate about what care is for seniors, for those that are going through dementia, and for the caregivers that support them that historically have not had a lot of resources. And so it was important for me to be a part of this group to try to simplify a little bit, and we're going to go into that in a minute, but I'm just glad to be a part of it. I feel like the direction that I come with, or the lens, is somebody who just has a passion for serving the industry, and thankfully my friends, starting with the person over here to my left, is another wonderful resource that comes from a lot more personal experience herself and also has her own personal story. So Dominique, why don't you introduce yourself?
Sure. So I'm Dominique, and I've worked in healthcare for about 2 decades, and so I've always kind of seen healthcare through the eyes of healthcare planners, and also thought about patients a lot and trying to make healthcare better for them, but never as much in the long-term care space. So I think now, having had a dad that was diagnosed with Alzheimer's about 8 years ago, and going through the process of having to navigate the kind of the social and the medical and the financial system for him alongside my sister, my partner in crime, I've realized how complex it is in its own unique way. Like, healthcare's complex enough, but it was so complex that we really had nobody as a guide, you know? We had nobody to really show us the way, and there's so many different areas that we felt really blind in. And so looking at this CMS guide model has really been a hope that it can be easier for others than it was for us to get, care, and also for the caregivers, because they, we had a lot of trouble finding caregivers, and it's very taxing for caregivers to take care of folks like my dad. Nicole, what do you think? Did you?
It is, yeah. I have a personal story, and that led me to my professional passion. My grandma lived with our family when I was growing up, and that relationship was so special to me, and it brought me to studying gerontology and working in senior living and seeing and working with people living with dementia in that capacity. So it really was unique in that my personal lens and seeing what the families go through and what we went through, but also on the professional side and interacting and wanting to elevate the life of the people that I work with, knowing how much support is needed and how families would ask me questions about what they were going through, and understanding that there were a lot of questions that needed answers. And if I could provide some of that with what I'm doing now and give them hope and encouragement and information, I think we feel empowered when we know what direction to take when we feel lost. So, and a lot of what our conversation was is that we're hopeful with this new information that people will feel more supported, and that they will not feel as lost as maybe they previously had. But I love the combination of it's not only supporting the person living with dementia, it's supporting the family caregiver, and those really, I believe, go hand in hand.
Yeah, my name is James, and I've been working in the senior living industry for over 15 years. Started as a caregiver in a retirement community, and I have really, I would say, grown my perspective about dementia over those 15 years. First as a caregiver, being assigned tasks and duties to go help this person. They have dementia, and here are your care tasks. To now, I'm an owner of a dementia care and education business, because as I was progressing through my career in senior living, I realized the place that I could probably have the most impact was in this space, specifically of dementia, where it is the most misunderstood of senior care. And our organization, the surprising thing for me was that we were building out a very similar program to offer in our own community of San Antonio to help family caregivers to be better caregivers. Everything you guys just said, we thought, yes, we need to do that. And so we've gone about starting the work. And boy, was I surprised when CMS announced the guide model and the guide program. And I had so many people reach out and say, hey, is this what you're trying to do? And I was like, oh, yes, it actually. But once the shock, went away, I realized what an amazing signal from our government at a national level, not at a state level, to acknowledge and recognize that maybe the best way to help somebody with dementia is to help their caregiver.
Right.
I thought that was really interesting, and so that was my reason for wanting to do this project.
Yeah, that's terrific. So, James, I want to kick this back to you, and I want to talk really about a couple of the examples about why we chose some areas. This is a pretty complex program. It's a little daunting for people of average intelligence like me. So when I look at these pieces, and there could have been a lot of things we decided to discuss, but we wanted to keep this succinct. We wanted to be kind of direct and just try to have some resources, and I guess what I used in the video was layman's terms, so people like average intelligence like me could figure this out. And so what were some of the things that stuck out to you of the areas that why we chose to focus on?
Yeah, queuing back to where we started discussions about the guide model in the first place, it wasn't immediately obvious to us, we should make a video for family caregivers who are going to want to learn about this program. And I think we just really had some really interesting conversations that we all decided what comes first. And what came first, or what should come first, is that the people who are going to benefit from this program need an explainer. Because I don't know about you, but I was reading through the website, I was clicking on all the resources, and I'm from this business. I have this terminology, and I was thinking, oh my goodness, like this is going to be a little bit tough for people who have no context for this.
Right.
And keep in mind, they are going to be in the thick of caregiving stress.
Yep.
And so I thought, we thought this would be appropriate to use our time to provide maybe a cleaner, more layman's version of this model. Dominique, I know you in your introduction you said that this, or at least you alluded to that this might have had a really personal effect, in your recall of your caregiving responsibilities. What do you think of when you see this type of program, and maybe, why wasn't it there 8 years ago? But what are your thoughts as somebody who has experienced this directly as a family caregiver? What are your thoughts on this?
So the guide model, I think you said part of this yourself, is it's such a concretely helpful program, I think, for people. And, I've worked in a bunch of on a bunch of projects in healthcare where there were CMS programs that were meant to improve like interoperability of data or how we care for different populations. But I have to say this program especially strikes me because it's so tangible in how it can help to improve awareness, but also actual direct ability for provider teams to take care of this population and get reimbursed for it. Because I think a big part of the problem for senior care is that we don't have enough gerontologists. We don't have enough people that are specialized in elder care, let alone care for people with dementia. And so, having worked in health policy a little bit, I've always felt like that was a big, huge gap. And I know all of my friends here have seen that too, living it, every day and working with the elderly more than I have. So yeah, to me, what strikes me most is it's both personal. Because my dad really needs these services, but I also have probably 50 friends whose parents or loved ones have gone through this. And finally, there's something that could be the beginning of, I hope, many other programs, both public and private. As we know, CMS often leads the edge as far as new demonstration projects that can inspire innovation in the private industry. So I'm hoping this is the beginning of many programs where there can be more guidance and support to caregivers also to help too, because right now they're mostly unpaid, right?
53 million unpaid family caregivers.
53 million.
53 million.
So
that's huge.
What gives you hope that this program is opportunistic, Nicole?
Right.
What when you look at what part you were responsible for in this video, what are you excited about, and why do you think that this could really work?
Well, when I hear from families and in my own life, two of the major hurdles for people is feeling lost and not knowing where to go and not knowing what to do. And the guide program really addresses education and training. Yeah. And the other hurdle and challenge for families is they need respite and they need a break and they need to feel supported. And that's the other piece of the guide program is funding for that respite. So it is addressing the two concerns I hear most often. So I think that I'm hopeful because it's actually really meeting the need, right? If you create a program, you want it to actually be helpful and applicable. And what I'm excited about is that in our conversation and in our work is that we are a conduit of sharing that it's even an option and available to families. Yeah. I think that's going to be maybe part of the challenge is that we've got this program, CMS has created it. Is there enough, reach so that families that are in the trenches actually know that it exists for them and it's available for them, that it's going to be accessible. So if I'm a small part of that, I'm really thankful for us to be able to do that.
It's a really good point. I was thinking about, I'm in the business and I specifically am trying to create a like program, and I didn't hear this directly from CMS or Health and Human Services. I had peers in the industry send me a link saying, hey, have you read about this? Yeah. And as I've talked about it with other people, they're like, what is that? I haven't, and these are people from the same industry as ours. Totally. So I think that's a really great point, Nicole, about if we professionals who are, in the proximity of information like this are maybe barely receiving it, there's a lot of work needed here for families to even know this is coming down the pipeline.
And
Please, go ahead.
I've thought about it similarly from the perspective of providers. And so, so in the video, we talk a little bit about how providers are going to be key to this, right? Because Part B Medicare providers are the ones that are going to be eligible to provide the services. But I think one of the challenges, which I hope we can overcome, is getting enough providers aware of this. But it's not an insurmountable problem. I think we can help to, just like we're kind of, hopefully the guide will help caregivers, we can create more resources or spread this video to actually help providers too, to know that it is possible for them to get paid for doing this good work, and they'll do right by their patients with dementia and feel better about having that support.
Yeah, and Dominique, you and I were talking about, I think just earlier today, saying, we didn't focus a lot on the physicians in this particular video. We're not doctors. I don't want to even pretend that I have any idea of what our physicians are going through. But we know that doctors are there to be able to treat. And if you're a primary care physician, the last thing we want to do is muddy the waters or try to cloud any judgment. What we want to, if I can speak for all of us here, what I think we want to do is just to make sure that people know that these resources are out there and that they can come to their doctor because they're going to be integrally involved in this process. And if they can do each of their parts, then that leads to reimbursement and that those resources more quickly. Yeah. Nicole?
And I am hopeful, having this conversation where you're talking about providers. I had a conversation with a few of my podcast guests, and there is not a physician or a field of study that is just a dementiaologist as a physician. True. There needs to be, I believe, and I can't take credit for this, Jason Karlowicz, that can we grow a movement? And is this the beginning of that movement, focusing on supporting people living with dementia and their caregivers, where we create almost like how cancer, has centers, and that is the focus, is supporting people that are walking through this journey. And so if anything, we've got neurology, we have geriatric physicians, but there really needs to be something dedicated in the medicine world for this. Yeah. And so if this starts to create that conversation,
a movement, just like you said.
A movement. I'm hopeful.
Yeah.
So one of the things I want to make sure that we're communicating here today is that there are some really cool resources, right? And we didn't focus on those either because we thought that those might have been a little bit easier to understand. Really cool infographic, right? And we built some really neat tables and graphs here that we might have alluded to somewhat in the video. But those, man, there are a ton of resources there, and that's awesome. And we just happened to take a few that might have been a little bit difficult to understand, to comprehend, and to take action upon. But I want to give CMS credit here. They really did a good job in providing a number of resources that can speak to people in different ways, especially when they're filling some of these roles we're talking about, right?
Yeah.
And it felt more personal. I think that was something we had discussed, is that in all of the data I've read from CMS previously, which I have not read all of it, so someone might find something, but that they really created the story of the person and the caregiver, and they are taking into account what that journey is like, and it is up on the website. You can see the journey of what it does look like to be supported and what it looks like to not be supported. And I think seeing the visual contrast of that, we thought was helpful in humanizing that.
One of the things I forgot to mention that I want to ask you about, James, is I think all of us have mentioned a couple of disclaimers along the way, and that's necessary, right? We're not the professionals that either set this up or the legal entities. We're just humans,
Not
right?
to mention, we're not the regulatory bodies.
That's right,
So
absolutely.
go to CMS for the real deal.
Exactly. So we very much encourage, and James, feel free to ad-lib here. There's a lot of resources there, but just for liability's sake, we're your friends here. We're not the governing bodies, we're not the officiating bodies, and we're not the pros. We're just people that want to help figure stuff out.
Yeah. You know, what that makes me think of, though, Jonathan, is that yes, we are all citizens. I think that's what we're saying here. But it made me think about, as you were saying that, it is our responsibility to give feedback to our regulators and our lawmakers and people at Health and Human Services need to know all of the things that we are talking about, you know, and the program sounds wonderful, and I have a lot of hope for it. And one of those things that makes me think, maybe this is a little cynical, but I think about, well, why would CMS want to do this? They want to save money down the road. They want to save money down the road in hospitalizations and skilled nursing visits. And so their big bet here is that we can help save healthcare costs down the road if we help family caregivers to get respite, to get education, to get training. So to me, that is the big, easy thing to understand from this guide model, is CMS is betting big on helping caregivers. And I think that's a really great place to start.
Right, yeah.
Yeah, 100%. I think we all want this to happen. There's hope, but there's also, we're cheerleaders here too.
Yeah, we want it to work.
Yeah, and it's also like a better future for us and our children, I mean, these are changes that, since they're being implemented through CMS, that might change a little, but they're pretty long lasting. And so it's my hope, and I think my belief, that there will be other programs that kind of alluded to earlier that will build off of this, and that it's going to be good for caregivers, but also for people that are really worried about what it's going to be like the future for future generations of people that are going with fear into adulthood, because dementia is actually quite common when you get above a certain age. So I think that's really good. And I will add one more thing, that from a system level, and James, you alluded to this, for providers, especially in smaller communities, but all over, people are really worried about their own patients. So providers really have a stake in keeping their patients healthier, having better education, not feeling like they have to shy away from caring for their elder patients. They have resources and support to do that, so they can feel right by their patients, and they can also get reimbursed for it, so they don't have to feel stressed about taking care of them in this way. So.
Yeah, pulling some of these conversational threads together. I think part of our video also addressed some pitfalls or potential challenges that we see with the program, and I think if we're being honest, there's probably a lot of questions that we ourselves here, the four of us, would say, that weren't answered, that we're a little bit, cautiously optimistic of. And drawing some of your earlier comments, Nicole, about there isn't a dementia doctor, there isn't a dementiaologist. I like the phrasing of that. But there should be. And the thing that is a little bit challenging for me is that the program participants, the people that can participate in this, Part B providers, presumably they are the ones with all the dementia expertise. But I know day to day, doing the work that I do, there are so many times that we are in some way educating physicians, neurologists, pharmacists, other people on what dementia actually is in practice. They see their patients once every 3 months, 6 months, or longer. We see our residents of our dementia care community every single day, all the time. And so I do think that there is a little bit of a challenge for me thinking about, well, the quarterbacks of these guide teams are going to be people that are a little bit less, informed. I don't want to say that in a rude way, but they just don't have as much visibility to things as maybe dementia care practitioners in senior living, assisted living, memory care certainly would have.
I listen to that too, James, as somebody who knows a lot less than you as far as how to be able to care for people with dementia, but I also want to almost come to the defense of the physicians that I hope that the people that are in the guide program are looking at the guide model as hopefully being able to be candidates and are able to be a part of this, that you kind of look at this as hopefully part of the team. Make sure you realize that a lot of these doctors, they're doing this for the first time too. This is a cool program. We're excited about it, but we're all kind of starting from scratch here, and so I think there's just going to be a natural frustration for the common consumer. The people are going to be involved in this program. So I think we just need to exercise a little patience, while we're going through this, and realize that there's not a lot of experts here, and hopefully CMS is going to provide additional resources, and who knows, maybe we'll create another video down the line and hopefully make that as simple as we can, collectively too. What do you think, Nicole?
I like it. I think it's great.
I'll add one quick thing, just that to your point, Jonathan, you were making me think that we have such a standardized model of healthcare in our country, right? And so here in the United States, and the senior care communities, I think there's not a lot of familiarity with those players, with those facilities, with that world, with the type of caregivers that you need, that James is so familiar with. But I think one benefit of the guide program, and the guide model program as we call it, is that it's teaching existing provider teams how to be navigators. And so it's not just about, we've used the word physician a lot, the four of us, and including in the video, but it's really about a new kind of care thinking, about care coordination and care navigation that really is meant to get to that missing piece, I think, of our healthcare system connecting with our long-term care system. Not to mention just in our healthcare system alone, of having someone by your side, a navigator, that can help you get through from A to B, from post-acute setting to community to hospital, to all the different places that you never knew you'd need to go before you had a loved one with dementia. So I think that's something that resonates. I guess I'm going back to your first question, Jonathan, that there is that navigator piece. I think that could be maybe a little bit of a bright light in all of this that might help the teams address your concern, James, which I share. This is new for a lot of people.
So I think that's a good segue as we kind of wrap up here, is bright light. I want to use that as kind of a way to say, Nicole, what do you think is your bright light when you're looking into this? And we're about to kick this thing off, right? It's right around the corner, and everybody is going to start applying. When you're being the bright light for family members, for caregivers, for those with dementia, and for the care navigators, these doctors, what's the bright light here for you?
The bright light for me when I work with families is I have another resource to direct them to where they can feel supported, and an option, right? I think, our hands aren't tied, and we know there's a lot of people doing a lot of really good work. This is another extension of that. And like I mentioned earlier, I'm hopeful that this is the beginning of a movement to support the whole care team, which really includes the families at the heart of that.
Yeah.
James?
Yeah, I think it's a great signal. You know, all of those kind of potential, how might we say, cautious optimism that we may have. There's more optimism than caution, and I think this is something that it's a huge signal from CMS that they think this is the way to go. And you know, I think maybe Dominique, you said it earlier about when CMS sets a precedent, when they get kind of out of the gate with something, it almost gives other people permission to come in and say, oh, that's interesting, maybe we should go into that space too. So, you know, dementia education, training, resources for the caregiver, respite resources, 24-hour hotline. This is all really good foundational stuff. And let's keep in mind that this program is a pilot that is going to last 8 or 9 years. And so this is the first draft of that program. Yeah. So, I mean, I'm going to be throwing my full support behind it to, you know, find our interdisciplinary team in our local area, and, you know, we're going to get involved somehow.
Yeah, and we all have a collective desire to have it be successful.
That's right.
So.
Yeah.
Yes.
Dominique, anything else?
No, just that I'm really glad that we have the chance to do this all together, and that we get the opportunity to help share this new resource with other people. Yeah.
Yeah, and when I think of Bright Light, the first thing that pops into my head is a lighthouse, and it goes back to what you said at the beginning, Nicole, that if this gets reach, you know, if that light is seen from a long way away around this country, and we can use these results and have these, you know, hopeful outcomes that we all want, that this is continued on, that this really can carry upon generations and be successful. I want to create a movement, and I think that's the perfect word, Nicole. So we hope that you guys can watch the video, have some feedback, and hopefully it's a great resource to you, and go CMS.
Yeah, good luck.
We'll include where to go, links, and how to learn